Hello, my name is Francesco Arlia Jr. I'm the CEO of Light Years Ahead Corp, and we are representing the equipment, medical equipment, designed and developed by Marcello Baldacchini. Mr. Baldacchini has been known in the industry for creating medical equipment that helps the body heal quicker using infrared light therapy. He has created some of the most unique infrared light laser machines that use a very specific infrared light, and now in recent years he has focused his attention on finding how the body heals using magnetics, and he has discovered a very specific magnet that is very synergistic to the body and works with the body in conjunction with the north and south hemispheres of the planet. So with this, we will get into how this machine works and the steps that you would take to administer its use. Okay, so now we're going to get into the theory behind the magnetic modulator. So first you need to understand what are the four elements of pain. Pain is comprised of heat, cold, pressure, and electricity. Now, heat and cold are body temperatures. We can't control that. Your body temperature is constantly changing. When you eat, okay, your body temperature increases in the stomach area because there's more blood flowing in this area to digest. So some people actually feel cold in their feet, okay, or in their fingers, or even other parts of their body when they're eating. It's just the way their body operates. So heat and cold cannot be controlled. Your body is constantly fluctuating. Pressure is what created the pain in the beginning. Whether it was you fell down and twisted your ankle, you hurt your knee, you banged your head, whatever it was, some form of pressure. You pinched a nerve, okay, you pulled a muscle. So that pressure, okay, is also something that created the pain. So if it didn't happen, you wouldn't have the pain to begin with. So the only thing that we can control, which was discovered by Marcello Baldacchini, is the electricity. Okay, now the electricity is what gets trapped in the pain area, and we can control that with the magnetic modulator, with the particular type of magnet and synchronization of this machine that was developed in order to eliminate the electricity from the area and hence get rid of the pain. Okay, so I'd like to discuss the treatment plans now. You can treat either acute or chronic problems. They're treated differently, obviously. The acute would be 1 to 6 visits as recommended, and you should have immediate results. And the chronic would be somewhere between 12 to 18. It's highly recommended there would be 2 to 3 visits per week for at least 6 weeks. There is what I refer to as the bounce curve, where a patient is going to be feeling better immediately. Around the 7th session, they will either plateau or they could even drop in the results. But as long as they continue to move forward and continue with the visits, by the 8th or 9th, they will bounce back. And then at that point, they should achieve a goal of feeling much, much better. Okay, so now I'm going to explain how the machine works and how to set it up so that you can treat a patient. First thing we're going to do is turn on the machine. Okay, you will see that the top panel lights up. Okay, the first line deals with the time that you're going to set the machine for treatment. So the first treatment that you do is to stimulate the nervous system, which we will get into, and I will explain a little later. But you would set the time by just pressing the buttons positive or minus. So normally you would set the time for at least 6 minutes, okay? And then you would press the start button to start the therapy treatment. The next line is for the 3 different manipulators. You can use one manipulator, okay? Or you can use all 3 depending on what the patient presents themselves with, okay? So you would have to take the patient's pulse initially, okay? You get their pulse. If it's 86, then you're going to set this to 86, okay? And move this along to 86. And we are good to go. The next step, okay, would be to start treating the nervous system by stimulating the nervous system with the magnetic modulator, and you would use this manipulator. Okay, now here is a picture of your nervous system. You would start using this from the top of the head, come down, okay, bring it all the way down the left leg to the feet, bring it back up to the top of the head, then bring it back down and trace to the opposite leg, to the feet, all the way to the toes, and then bring it back up again. Then you would go down the left arm all the way to the fingers, come around, and go back up to the top of the head again. Then to the opposite arm, and back up again. Then you would stimulate the entire back from the shoulders across and wrap around, and I'd like to show this on my body. You would wrap around to the side and get as much of the nervous system from the back as possible. So you would continue that left and right, covering the entire back all the way to the buttocks area, okay? Cover the entire buttocks area and then go back up and continue on until you reach the shoulders again, and then start and repeat the exact procedure again. Go up, go down, and continue. And you would do that continuously at a relatively even speed, not too fast, not too slow, and you would continue it for the 6 minutes. That is stimulating the entire nervous system. Okay, so now I'm going to explain the manipulators. First off, this is the first manipulator you would use to stimulate the nervous system, okay? The important factor is that it's not so important which manipulator you use, but that you understand that the purpose of the magnet is to get the cells of the body to be moving very, very quickly, okay? And the magnet has that effect on the cells of the body. So this particular manipulator has a large face and can help you cover the entire nervous system from behind very quickly, all right? So, and it's also spinning in this motion. Now, you would take this and you would cover the nervous system as I explained. Then you would use another manipulator, such as this one, when you're ready to focus on the area of pain on the second treatment, okay, which is focusing on the area that the patient is complaining most about. So if it is the arm, okay, this manipulator is more comfortable than this for working. So you can use this and move it up and down about the arm, okay, and then switch. See how easy that was, okay? And then bring it all the way around and you want to bring it to the hands, to the fingers, come around, go back up, the shoulders. You really want to cover the entire area. So this works much more comfortably. Then you have, the pen manipulator. The magnet is very concentrated right here in the area. So if you have a very specific pinched nerve in the neck area, okay, this is more focused. Okay, so this can service that area a lot more comfortably. Again, the importance is getting the area of pain, okay, to be fully handled with whichever manipulator is most comfortable, but covering the entire area. Okay, if there's back pain, then you would use this because it is the most comfortable for the back and covers a much larger area. Okay, thank you. So first thing we do is we measure the patient's pulse, okay, because the pulse needs to be input into the Matron, as that is the frequency that the machine is going to coordinate with the body. We set the time to 6 minutes, and we're going to spend 6 minutes stimulating the nervous system. We start from the top of the head, going down the central spine, down one of the legs, all the way to the toes, and then come back up again to the head. Applying a light pressure and moving at a steady pace, as demonstrated very well here, and coming back to the front of the toes and back up. We're then going to go down one of the arms all the way to the tip of the fingers, wrap around, and come back up to the neck. Over to the other side, down to the tip of the fingers, and coming back around. Then we're going to cover the entire back, starting from the shoulders and wrapping around the sides of the body in the midsection to capture all of the nerve endings. As we approach the buttocks area, we need to be aware that the buttocks has several nerve endings and needs to also be fully covered. It should be well noted that sometimes just by stimulating the nervous system, the patient will start feeling better. There are many cases of the patients feeling better just from stimulating the nervous system. But that does not prevent or stop us from continuing the full therapy and focusing on the area of pain that was originated by the patient. As we come up to the top of the shoulders, covering the entire back, we've almost completed our first time pass, and we will continue to do this, starting over again, going down the back for 6 minutes. And this is the procedure we will follow for the first 6 minutes of therapy. So now we're applying the magnetic modulator to the affected area of pain, which in this patient is both her knees. So it is most important that you cover the entire leg from the top of the hip all the way to the bottom of the toes on both legs. And there's no specific system to this other than making sure you cover the entire leg. So the front, the back, the toes, you just want to cover the entire extremity from top to bottom. There are two different manipulators that you could use in this area because this manipulator that's being demonstrated now is easier to get into the center of the leg area and may be easier for the technician to use to cover the entire leg. The most important part is that the patient is comfortable while you are providing treatment. They need to be in a comfortable position so that you can reach every area that needs to be reached, and at the same time they're comfortable in being treated. This particular patient is comfortable standing, and therefore she's standing. Someone who may be feeling more pain may be more comfortable sitting and just needs to expose their legs in such a way that they can be completely covered with the manipulator. And this treatment will continue for 10 minutes, up and down every part of the leg until the session is finished. Okay, I'd like to explain that the magnetic modulator should not be used with electronic medical devices that provide life support, such as a pacemaker or a pump, just to give you a few examples. At this point and at this juncture, we highly recommend that it is not used in conjunction with patients that have this life support equipment.